In the video, we'll review Clonidine Hydrochloride, a versatile medication used in various clinical settings. Let's dive into its therapeutic uses, mechanism of action, side and adverse effects, nursing interventions, and patient education. Stay tuned for a quiz at the end to test your knowledge. Clonidine is often prescribed for patients with high blood pressure, especially when other medications haven't worked. It's also available in different forms, like tablets or even a transdermal patch, which provides a steady release over a week. This patch is particularly handy for patients who struggle with daily pills. Here's something fascinating about Clonidine. It's not just for hypertension. Did you know it's also used off-label to treat conditions like ADHD, anxiety, and even opioid withdrawal? That's the power of this multitasking med. Mechanism of action. Clonidine works as an alpha-2 adrenergic agonist. By stimulating alpha-2 receptors in the central nervous system, it reduces the release of norepinephrine. This leads to decreased sympathetic outflow, resulting in lower blood pressure and heart rate. Sedation and calming effects are also beneficial for ADHD and withdrawal management. Remember, the key concept is the reduction of sympathetic nervous system activity. Side and adverse effects. As with any medication, Clonidine can cause side effects. Let's break them down. Common side effects include drowsiness or sedation, dry mouth, and dizziness. Less common but serious adverse effects include bradycardia, rebound hypertension if the medication is abruptly stopped, and severe hypotension. Monitor patients closely for these effects, especially during dose adjustments. Nursing interventions. Nursing care for patients on Clonidine focuses on safety and efficacy. Key interventions include monitor vital signs, regularly check blood pressure and heart rate to detect hypotension or bradycardia, evaluate sedation levels, be vigilant about excessive sedation, especially in older adults, prevent rebound hypertension. Educate patients not to stop the medication abruptly and work with prescribers to taper doses if needed. Patient education. Patient education is crucial for ensuring medication adherence and safety. Here's what you should teach patients. Take as prescribed. Emphasize the importance of taking Clonidine at the same time daily. Avoid alcohol and sedatives. These can amplify sedative effects. Rise slowly. To prevent dizziness or falls due to postural hypotension, stay hydrated. To combat dry mouth, patients can sip water or chew sugar-free gum. Report symptoms promptly. Encourage patients to notify their provider of severe dizziness, slow heart rate, or signs of rebound hypertension. All right, now let's see how much you've learned. Here's a quick quiz to reinforce your understanding. Clonidine primarily works by A. Blocking alpha-2 receptors, B. Stimulating beta-1 receptors, C. Stimulating alpha-2 adrenergic receptors, D. Blocking beta-2 adrenergic receptors. The correct answer is C. What is a serious adverse effect of abruptly stopping Clonidine? A. Seizures, B. Rebound hypertension, C. Hyperkalemia, D. Myocardial infarction. The correct answer is B. A patient taking Clonidine reports dry mouth. What should the nurse suggest? A. Stop the medication immediately. B. Chew sugar-free gum or candies. C. Drink less water to avoid overhydration. D. Take the medication with alcohol to alleviate the dryness. The correct answer is B. True or false? Clonidine is an alpha-2 adrenergic antagonist. This is false. Clonidine is an alpha-2 adrenergic agonist. True or false? Dry mouth is a common side effect of Clonidine. This is true. True or false? Bradycardia is a potential adverse effect of Clonidine. This is true. By understanding Clonidine hydrochloride, you're better equipped to provide safe and effective care to your patients. Well, that ends this video. If you found this episode helpful, don't forget to like, share, and subscribe for more nursing care plans and study tools.